you run that scenario by most people like, hey, if you take this med, there's a chance this can happen. Or you can make these lifestyle changes with your diet and your movement. It's going to be a no brainer for most people, but most people aren't given that choice. They're not being provided with informed consent. And that has to be a foundation of our medical system. Just, it has to. And it's not. Instead, our medical establishment is run by corporations who prioritize profits over outcomes. And that's not hyperbolic. It's literally built into foundational documents. That is the purpose of a corporation. It's to drive income for shareholders, drive profit for shareholders. It's not to improve the mental health of the American public or anything like that. It's to generate profit for shareholders. And I almost trust anecdotal evidence more than I'll trust something I'll read in a journal at this point. So I've just heard so many times from people that it's made improvement on their mental health when they weren't even doing it for their mental health. So you remove that whole placebo effect that's the backbone of so many SSRIs and stuff like that.
Today, I'm joined with David. David, how are you? I appreciate you being here.
Thank you. I'm good this morning, Adam.
Awesome, awesome. For those of us that don't know who you are, can you, tell us who you are and what you're all about?
Sure. So I started out in healthcare as a volunteer first responder, and I really enjoyed that. So I upgraded to EMT. I became a senior certified pharmacy tech. Then I became a registered nurse and worked for about 10 years in an inpatient psychiatric. And over the course of my career there, I saw kind of pharma scandal after pharma scandal, especially with psychiatric meds started getting me really concerned about the standard of care. And then at the same time, my girlfriend started doing carnivore and was having amazing benefits from it. So I became carnivore adjacent, started cooking carnivore and eating carnivore myself or close to carnivore. I can get away with some carbs on, so I eat keto, but I kept meeting people when we would go to meetups or hearing people in group coaching calls that started doing carnivore for autoimmune issues, that sort of thing. And they would report almost as a happy side effect. Oh, by the way, my depression and anxiety got way better doing carnivore. And it just really piqued my curiosity and has kind of changed my career trajectory at this point.
Yeah, that's awesome. So you said your girlfriend was on the carnivore diet. What is there a specific reason why she started that? Was it just weight loss or other issues?
Ankylosing spondylitis. So she was diagnosed in the early 2000s and had been on a variety of medications over the years, helpful, but not perfect, always dealing with pain issues. And it was Michaela Peterson and Sean Baker and Jordan Peterson, hearing them talk about the carnivore diet on Joe Rogan, it's made us curious to start it and try it. And we're just blown away by how much help she had all her symptoms go into remission and was able to discontinue medications. So she was having a better outcome just from eating carnivore than she had from decades of doing trial and error with different meds, some of which were very powerful, very expensive, very potential for very severe side effects. So yeah, it was life changing for both of us.
Wow. So how has she progressed just in terms of eating the carnivore diet and fixing those issues?
So a lot of her issues were arthritic type pain, especially in her back. That's kind of the hallmark of ankylosing spondylitis. And so that's way better. And if she ever has a cheat meal or something sneaks past her guard, that's always a good reminder for how effective carnivore is because she'll feel it right away. She'll feel it in her joints. Also had some neuropathy go away. And, with her too, she reported an improvement in anxiety after going carnivore too. And again, that always makes a blip on my radar when I hear people start talking about those mental health improvements.
Yeah, absolutely. That's really awesome that she's seen those improvements and things are getting better for her.
Yeah.
And
Oh, weight loss too, of course. Yeah.
okay, okay, awesome. It's interesting to me how many different things that eating this lifestyle can fix. Like with myself, I personally started for an autoimmune condition, vitiligo. And again, because I seen Joe Rogan talking about this, he has the same autoimmune condition and he seemed to see improvement with it. And I thought, well, it's not going to hurt to try. And lo and behold, 5 months into my carnivore journey, it started to reverse, which is absolutely incredible.
Hmm.
And the side effects for me were, at least 20 different other things that were fixed. Plantar fasciitis, it was completely gone.
Wow.
Osteoarthritis, gone. A TBI that I had from 2017, 6 years old, completely healed from that. The list just goes on and on. Now in terms of what we're mainly going to focus on today in our discussion, which is mental health. I would say a mild form of depression, and I had anxiety. I'm a photographer, so I always wanted to be on the other side of the camera. I didn't want to be on camera. You would
Yeah.
never see me doing an interview like this prior to the carnivore diet. And yeah, that is absolutely just transformed everything in my life, confidence and the ability to speak in front of others and be comfortable and confident. It's incredible. So I can't say enough good things about eating this way for sure. But in terms of mental health, it did help with an overall feeling of just wellness, that everything's okay, even keel. And I don't know if your significant other has experienced things like that herself or
Depression wasn't something she struggled with greatly, mostly anxiety, especially situational anxiety, but that got markedly better. Yeah.
okay, awesome. Very cool. So let's talk a little bit about your website and what it is that you're all about. Can you describe what that is and what your goals and purpose of that is?
Yeah, so I'm trying to get off the ground as a health coach. I'd love to use a combination of keto or carnivore diet, depending on the person, along with some kind of guided writing and mindfulness skills in order to set them on track to be more independent and autonomous with their mental health. So, so I called my business Describe Health, and kind of a double meaning there. One is I would like to see people move forward on as few medications as possible. And at the same time, I feel like having those mindfulness skills and being able to rationally detach and check in with your body is a really important piece of that puzzle. Initially, I wanted to do some short-term uh, coaching programs and set people on that path, and I'm having to try and rethink how I'm doing things just because medications are so difficult to come off of, especially psychiatric medications. So where I'm kind of at now is I think you have to set the foundation of cleaning up your diet before you can even start, and then the process of coming off of psychiatric medications or coming down on them takes a really long time, way longer than a coaching relationship should last. So I want the coaching relationship to involve fostering those skills that are going to be helpful for a person as they progress through their journey and as their life changes later, as they hit different milestones in their life and their health needs change and their nutrition needs change. I want to help them kind of have the tools to navigate all that when they come to it without having to go to the medical establishment and get another prescription. So that's the goal. Part of this process has been having to unlearn so many of the things that I learned over the course of my career in healthcare. And so, honestly, Adam, right now, I feel like I know less than I did when I first graduated nursing school, just because of how many things I feel like I need to unlearn and how many research gaps there are because research isn't done without a profit motive. And
Mhm.
it's gotten really hard to navigate for me. Everything can be so dogmatic. No matter what your beliefs are, you can find a research article that supports your beliefs. So that's been one of the most difficult parts of this journey is figuring out who to trust because I've lost so much trust in the medical establishment and the mental health establishment over the course of my career that like, I don't know what to believe anymore.
Right.
When we were in nursing school, the mantra was evidence-based practice, you know? Evidence-based practice came up all the time with every class, and we had classes on research, but we never talked about research fraud. So it used to be that I would read a study and I could, kind of skim it, read the conclusions and go, okay, I know that now. Now, when I read clinical research, it's like, all right, first thing I'm going to do is check the conflicts of interest. Then I'm going to see if their conclusions actually match their data. Then I have to wonder who funded these authors. I have to wonder were there ghost authors. I have to wonder about the funding of the journal that it was published in, and it just becomes infinitely more complex, time consuming, and difficult to trust anything. So um, it's not the way it's supposed to be, but I almost trust anecdotal evidence more than I trust something published in a medical journal at this point. And the anecdotal evidence I've seen with carnivore is just absolutely overwhelming. So many people that I've met in person at meetups and heard tell their story on YouTube or on group coaching calls who started carnivore because of an autoimmune disease. And then they put that disease in full remission without medications. And then they report as a happy side effect, oh, and my depression and anxiety got better.
Mm.
I've worked with thousands of people in an inpatient psychiatric setting who didn't have outcomes like that by filling their prescriptions and going to the pharmacy. So yeah, it's something that I hope changes in the near future. I know that there are groups who are kind of working on getting some research done to basically support keto or carnivore eating for mental health. I'm excited for that to get out there and hopefully see the mental health establishment kind of pick up on it and incorporate it more because there's the the stakes are very high. The suicide rates have never been higher. Rates of depression and anxiety have never been higher. There's more people taking antidepressants now than ever before, and it just keeps going up every year. So something needs to change because what the establishment is doing currently isn't working.
Yeah, absolutely. I commend you for your efforts and what you're doing in terms of mental health and trying to wean people off of their medications and live a more full life and live as they're intended to live without all these crippling and debilitating conditions that not only affect themselves, but it affects their family and their wives and their husbands and their children, and it just has a ripple effect in all of society.
It
So I
does, yeah,
definitely,
absolutely.
yeah. Absolutely. So to go back to your schooling, are you saying that you never really received any kind of training in terms of validating a study? Like they just said, here's where you find studies and this is how you look at a study, but not in depth in terms of, checking its validity. You never received any
Right.
training like that in school?
Well, we did receive training on checking its internal validity, like in terms of looking at the study design and different types of studies and p values and all that sort of thing, forest plots. We got training on all that. What we didn't get was like there was no talk about Vioxx or anything like that while I was in school, and I was in nursing school after a lot of that had gone down, and that was actually a medication my girlfriend was on for a while too before it was pulled off the market. And I think it's really critical for every medical professional to understand the details of scandals like that because it wasn't an outlier. It wasn't completely out of the blue. It was something that happened before and has happened since. And until you really dig into the details of it, like people, especially medical professionals, need to have an appreciation for just how bad things have gotten. So that one really had a profound effect on me, especially, well, OxyContin too. OxyContin was another one. And that's one that I think people are more aware of just because the opioid epidemic has impacted so many lives. And also because there are already documentaries out there about OxyContin and about the Sacklers and Purdue and all that. And they're in the news on occasion too, versus Vioxx. You really have to dig to find out just how bad things were. And actually, I mean, I think the audience who will watch a channel like yours, it's probably not going to surprise them as much as it would surprise other people. But we could dive into that a little more if you want. We could spend a little bit of time on that.
Sure. Yeah,
So
let's do that.
so in the late 90s, Merck was trying to bring a new pain medication to market, and it wasn't an opioid, so that was a selling point. The problem was they did a couple internal studies and they discovered that it had severe cardiac side effects for some people, that it would literally kill some people who took it. And they kind of looked at that, and leadership at Merck decided that they could design a clinical trial to conceal those cardiac side effects and bring it to market anyway, because they knew it was going to be massively profitable. So they ended up withholding information from the FDA when they submitted their application for it. They got it on the markets, and it was on the market for about 4 or 5 years before it was finally pulled by the FDA. So a lot happened in that 4 or 5 years. One of the things they did when they submitted it to the FDA was they had a analysis of myocardial endpoint that they just deleted. They just didn't include that in the information they submitted to the FDA, but they did send their data. So if the FDA had done their due diligence, they would have seen the cardiac side effects in the data that they were provided, and it would have never gotten approved, but they didn't. And that kind of put them in an awkward position because here's a drug that's dangerous, but we approved it. So it's kind of egg on their face if they just pull it off the market right away. Um, back at that point in time that all this was happening, when I would hear the term big pharma as kind of a derogatory slur, I would kind of roll my eyes. And my feeling was that, like, there is no way a conspiracy of that magnitude could happen, because there's just no way that these companies employ thousands of people. There's no way they're all going to like connive to put this drug on the market that kills tens of thousands of people. That it just didn't seem plausible to me. There would be whistleblowers, there would be people stepping in. And that opinion of mine was coming from a place of ignorance, because I didn't understand the industry. I didn't understand how clinical trials work or anything like that. What the Vioxx lawsuits revealed is it only takes a couple people. Everything is so fragmented. You've got your marketing team, you've got your clinical research team. The people who are on the ground conducting the clinical trial aren't the ones who are actually tabulating the data later. It's all broken up. And so it just takes a couple people for something like this to happen. So in the case of Merck and Vioxx, the same people who constructed the study to conceal the cardiac side effects, they had teams working for them to go after doctors after Vioxx was released who were noticing that Vioxx was killing people. They would contact them directly. They would contact their institutions. One of the lawsuits against Merck years later revealed that they had an internal list of doctors to discredit or neutralize, and they were emailing each other. They had these teams of people who were like, we have to go here and destroy this doctor. Like, they used the term destroy, and they ended people's careers. They ended the careers of doctors who were speaking up about Vioxx when they knew that those doctors were right, when they knew that Vioxx was killing people, because they were raking in billions of dollars every year it was on the market, and they wanted to guard their profits. So another one of strategies that they used was they fabricated a peer-reviewed journal called the Australasian Journal of Bone and Joint Health. And it was basically Merck propaganda disguised as peer-reviewed research. And that was published on Elsevier, the same company who published all my nursing textbooks, in nursing school, and is still, publishes all sorts of. They're the biggest publisher of medical journals and textbooks and all that sort of thing in the world. Not that they were not that they were in on it, but it just goes to show that it, it involves everybody. It involves everybody. So uh, eventually, the data was overwhelming, and Vioxx did get pulled off the market, and there were class action lawsuits, but there were at least 55,000 people that were killed. Many, many more had strokes and heart attacks, but survived. And then fines were less than the profits. So there was no real disincentive to stop that sort of behavior. You would think that the people involved, and we know their names, we know exactly who they were. It's in the court documents. The people at Herc who were involved, you would think it would be, a black mark on their career, but that's not what happened at all. I won't name them. I don't want to cause trouble for your YouTube channel. And it's kind of like Candyman saying into a mirror 3 times. If I say their names, all of a sudden their lawyers are going to appear in the room with me, and
Right.
we don't want that to happen. But
No.
one of them went on to serve on a board at Harvard, where they still currently serve. Another one has gone on to be the CEO of another pharmaceutical company, where their slogan is "Great people attract great people." It's like, if this was a movie script, people would say, like, this is too far fetched. You can't take this person who essentially led to the deaths of 55,000 people and then, pretend that they went on to be the CEO of another pharmaceutical company who says great people attract great people. Like that. That couldn't happen. Get out of here. But that's exactly where we're at.
Incredible.
Yeah. So that whole situation was something that really had me starting to question everything I had been taught over the course of my career in nursing, and that spilled right over into psychiatric meds. Um, we mentioned Joe Rogan earlier. It's funny how a lot of these roads lead back to people who've been on Joe Rogan. I didn't really listen to Joe Rogan much back in 2015, 2016, 2017, but I was taking a road trip and looking for stuff to listen to. And there was a psychiatrist who was a guest on his show. Her name was Kelly Brogan. And I was like, well, I'll listen to this. It's in my wheelhouse. It's psychiatry. So it might be an interesting conversation. And it was an interesting conversation. It was disturbing because she was talking a lot about psych meds I was giving to people every day at work. And she mentioned a book called Anatomy of an Epidemic by Robert Whitaker. And so as soon as I was able, I ordered it and read it, and just kind of opens a Pandora's box. That book explores the history of the development of psychiatric medications and the clinical trials and the marketing. And as somebody who was giving those medications to people every day at work, just incredibly, incredibly disturbing. And then it just kind of snowballed in there. I kept reading. I read there's very important research by a man named Irving Kirsch that he did in the early 2000s. So he was at Harvard himself. He was very pro SSRI. He was using Prozac with his patients. He was writing articles about how great it was, and he had a graduate student come to him and say, like, hey, let's do a meta-analysis of all the SSRIs on the market and look at their efficacy compared to placebo.
Hmm.
And he's like, all right. He wasn't too excited about doing that. But then weird things started happening. One was that you couldn't get those clinical trials; they weren't released to the public. This is the standard, which I never knew. I would have never thought that clinical trials would be something that wouldn't be publicly available. That
Right.
just science is transparent by definition. Why would clinical trials for medications doctors are prescribing and patients are taking not be publicly available? Why does a
Yeah.
doctor not get to read the clinical trial data for a medication he's prescribing? Like, that's just it's a messed up system to me. And so what they ended up doing was they used the Freedom of Information Act, and they got some of the clinical trials released, and they did a little analysis that did not look particularly profoundly good for the drugs they were looking at. So they repeated the process, except they did more FOIAs, and they got every single SSRI clinical trial that had been submitted to the FDA to date and did a meta-analysis of all of them and compared their efficacy to placebo. And their conclusion was it's close to negligible. So
Wow.
to be clear, that doesn't mean they don't work. It just means that they barely work better than placebo. And they were kind of blown away by that result. And I was too when I read it, but I was reading it over 10 years after they had done that study, after I had already been working in mental health for many years. And like I had no idea this was a thing either.
Hmm.
Um, so as I'm looking into this and as I'm learning these things, I'm looking at what we're giving to patients on my unit. So one of the things that we would tell patients all the time is your depression and your anxiety are caused by chemical imbalance that these medications fix. It was a very persuasive way to get people to try medications when they were struggling, but they were kind of hesitant to start them. And what I learned was there was no real evidence to support that statement. That was essentially marketing propaganda that's that the pharmaceutical industry was using to promote their drugs, both to the public and to doctors. But they didn't have any sort of scientific ground to stand on to make that claim. It was a hypothesis going all the way back to the 1950s when they first started noticing how drugs acted on serotonin and drugs acted on dopamine would seem to have these effects on people who were institutionalized. And it was a good hypothesis at the time. It made sense at the time, but they invested decades of research into it, and hasn't it hasn't it hasn't panned out. SSRIs don't fix a chemical imbalance that fixes your depression. They don't. It's not that they're not incredibly impactful for some people. They are, but at best, what they could claim is we don't know how this works. So I started looking at like our patient education handouts that we were using at my hospital, and our patient education handout on depression said, your depression is caused by a chemical imbalance and you'll probably need to be on SSRIs for the rest of your life. And it's like, all right, that's not right. Who wrote this? A couple clicks later, Merck. What's Merck? We're literally using a company owned by Merck to provide our patient education materials. And not that those materials are 100% wrong, but their bias is absolutely built into it. And when you learn how to look for it, it's right there. So, I went back and found my nursing textbook from when I was in nursing school, and I flipped to the page on depression and the section on depression, and it says the exact same thing. Your depression is caused by chemical imbalance of your serotonin system, and you'll need to be on medications to correct this for the rest of your life. Wow, they have a stranglehold on the entire industry. Their marketing seeps in everywhere.
Very consistent in their messaging, it seems like.
Very consistent in their messaging. Absolutely. So, yeah, it was really distressing, Adam. It was really disconcerting and depressing for me, and because I went from feeling like I'm on top of my game, like I'm really good at this job, I'm really knowledgeable, to completely having my legs kicked out from under me. I don't know anything, and I don't know who to believe anymore. Yeah, and that kind of persists to this day because there's just such a there's just such a barrier to having robust research that isn't biased in some way by whoever's conducting it. Not that it's not happening. It definitely is, but trying to figure out who the good actors are and who the bad actors are has been so incredibly complicated that it's really hard to know what to believe. It's really hard to not become dogmatic and just double down and only believe the studies that kind of reinforce what you already believe. Confirmation bias is very real and very rampant and something I struggle with too. And it's tough to navigate all that. I think I think that's something that'll resonate with the carnivore community just because, that's kind of been part of their experience too, is the medical establishment gets a lot wrong, even when you're living proof. There's so many people that are still hesitant to believe.
Hmm. Absolutely. Yeah, I definitely resonate with what you're saying for sure. I've always been I've always been more of a skeptical kind of person myself. I can't say that I ever was able to pinpoint exactly, like the right path or anything like that. I just always felt like what I was being told wasn't entirely the truth with most things. And as a result, I had a sort of a disdain or mistrust for the medical establishment. And since I found the carnivore diet, that seems to have only deepened with my experience because it's been so profound. And I feel so incredibly great eating this way. It's the exact opposite of what we're told is healthy. But yet I feel I'm 47 and I literally feel better than I did when I was 20. And you just can't explain that, based on the current narrative that's out there. So,
But
yeah,
Adam, this paper says you don't feel that good. And you're about to keel over of a heart attack. So sorry, but you're wrong.
right, exactly, exactly. So, what I'd like to dive into next is so you are a nurse in a psychiatric setting, and that's sort of a unique area in comparison to other areas of nursing. And you have an extensive experience in this area. So, what are some, I'd say, triggers for you that you have gone through and seen or experienced that made you so passionate about wanting to get this word out about maybe changing your diet as a possible solution?
Yeah. So to clarify, I was a nurse in an inpatient setting. With all that background I kind of provided about my cynicism about big pharma and that sort of thing, I applied for an exemption to the COVID vaccine and it was denied, and I was terminated by my employer just a few short years after winning a hospital-wide nursing award. So there were an enormous amount of staff who were lost to vaccine mandates in 2021, and I was one of them. So I'm no longer working in that setting, which is a mixed blessing. It's definitely resulted in financial hardships, but at the same time, for the reasons I already went over, I was no longer very comfortable there. I was no longer feeling like we were doing good work in that environment. I was seeing all these things that were just these systemic issues that were huge problems and not putting people on a path to wellness. So mixed blessing, and it's kind of landed me where I am now. So, but one of the things we noticed in that setting was the food. Of course, hospital food is just it's ultra processed, it's full of carbs, and it's full of sugar. And after learning about how much carnivore can improve mental health, it's like, well, no wonder people in the inpatient setting are struggling when they're in crisis. Their blood sugars are all over the place. They're not getting sunlight on their skin. They're not getting their circadian rhythm sets. They're uh, consuming sugar. They're consuming carbs. They're consuming all these chemicals, all this processed crap, basically. And they have an expectation that they don't need to change anything. They just, except for their medications, you know, they'll be talked to about lifestyle changes, but it's just kind of noise. The real expectation is that the doctor just needs to get their medications right. And that's their only path forward, only path to wellness is, you know, tweaks to their medications, increasing this dose, adding this med, that sort of thing. So, and part of my journey as I was learning more and more about the actual science behind psychiatric meds is just how many side effects there are and just how difficult it is to come off of them. So we would see patients that were going through med changes, and you'd always kind of expect that that would lead to some short-term struggles. It was not on our radar at all that, you know, somebody who had been on an antidepressant or an antipsychotic for a long time might be withdrawing from it for months and months, half a year and a half. Like we had no idea that that was thing. It wasn't until we had a new doctor start about a year before I was fired, and he was the first person I saw who actually diagnosed protracted withdrawal from people. We had no idea that existed, and it's just completely unacceptable because we were taking good care of patients who were in distress. We weren't recognizing the source of distress. In fact, they were being labeled as somatic or attention seeking and that sort of thing. when really what they were experiencing was normal after having their medications changed months prior. And we didn't know it. We didn't know to tell them that it was normal and help them get through it. And I was thinking back on all these conversations I had with patients and with coworkers about these things where I was the one who was basically spreading misinformation and spreading pharma propaganda because we were immersed in it and we hadn't figured out a way to cut through it. When those clinical trials were released by FOIA, one of the things that they studied was withdrawal. And what they would do is they would give somebody an SSRI for a few weeks and then stop it and then say, hey, are you having withdrawal? Like it was absurd, as if that would be applicable to somebody who's taken it for 6 months, for 5 years, for
Mhm.
17 years. This is what you're basing our knowledge of withdrawal off of is this ridiculous clinical trial.
That's
Y-
absurd.
Yeah. Even more disturbing than that was the sexual side effects and how the sexual side effects were so egregiously downplayed by the industry. So very close to it's 90 some percent of people who take an SSRI experience some level of sexual side effects. And those can be anywhere from mild to severe and permanent. They can be permanent even after somebody stops taking the medication. And
Mm.
nobody I was working with knew that. That was relatively new research that was done and robust, definitely not being put on blast anywhere. So at the same time, it was pretty obvious. And I feel a lot of resentment towards psychiatrists who didn't kind of question it. So, for example, you take medication and the manufacturer, the pharma company has done some research on it in order to promote it as a treatment for premature ejaculation. And they'll say this medication is effective within an hour of your first dose. 95% of the time, you're using it for this. Okay, so you go to your urologist and you get a prescription for that. Then you go down the hallway at outpatient clinic and you go see your psychiatrist, and they're like, "Oh, you're depressed. Well, here's a prescription for you. Sexual side effects sometimes happen. If they do happen to you, let me know." Like
Wow.
that's what the patient education handouts would say. They would carve out a caveat for sexual side effects. And instead of saying rates and severity and stuff like that, they would just say these side effects can occur. If they happen, talk to your doctor. And then you look at your two prescriptions, one from your psychiatrist, one from your urologist, and they're for the exact same med. If it's from your urologist, it's 95% effective within the first hour of the first dose. If it's from your psychiatrist, it's like, oh, don't worry about it. It's fine.
Incredible. Wow.
Yeah, it's so like that sort of thing is so egregious. I don't know why there isn't more talk about it. Why so many people in mental health establishment, they are not providing informed consent to their patients because they're not talking about these side effects and the prevalence and how severe they can be. Even if the most severe cases are rare, you have to tell people, especially, you know, we're talking about carnivore, but you look at all the different things that can be effective for depression other than medication. You run that scenario by most people like, hey, if you take this med, there's a chance this can happen. Or you can make these lifestyle changes with your diet and your movement. Like it's going to be a no brainer for most people, but most people aren't given that choice. They're not being provided with informed consent. And that has to be a foundation of our medical system. It has to. And it's not. Instead, our medical establishment is run by corporations who prioritize profits over outcomes. And that's not hyperbolic. It's literally built into their foundational documents. That is the purpose of a corporation. It's to drive income for shareholders, drive profit for shareholders. It's not to improve the mental health of the American public or anything like that. It's to generate profit for shareholders. And
Absolutely. Yeah, that's inherent for sure with the
yeah,
corporation. I mean, there's no other way around that. There would be no reason to form a corporation if you just said you wanted to help somebody.
right. Yeah, it's not nearly as profitable as telling somebody they're going to need to be on this for the rest of their life. If they try and go off it, they're going to be an absolute disaster, and their withdrawal is going to be mislabeled as a resumption of their symptoms.
Hmm. Absolutely. So you're wanting obviously to help people come off of their medications and things like that. So at this point in your journey with the coaching, have you seen this firsthand with anyone? And then, kind of what are your plans moving forward in terms of, how you're going to get the word out for this?
Yeah, good question. So it is a work in progress. I'm just finishing my business starter curriculum from a health coach institute, which has been a great program. So I've got the website up. That's still a work in progress too. I'm still dotting I's and crossing T's on there. And I'm still figuring out too the path forward with this because as a nurse, I don't have prescribing rights, but I also don't feel like I've got a lot to learn. And there aren't very many psychiatrists out there who specialize in things like protracted withdrawal and stuff like that. So I'm working on networking with some of the ones who are out there. There's a doctor named Dr. Joseph Witt Doring. He's out in Utah, and this is his specialty. So it's a work in progress, and it is a growing movement, and that's very encouraging to see that there is more awareness about this, even from people with real power and authority in establishments who are working on this problem. And so yeah, it's a work in progress. And I'm yeah, I do believe health coaches are a really important piece of that puzzle, but it's also a process that can take a way more time than a coaching relationship should last. So a big part of the process though is community and just having other people who are going through the same thing and kind of understand what you're going through. And there's validation in that. There's help in that. You can get advice. So there are several online communities of people who are working on tapering and that sort of thing. So I'm getting involved with them too, and just trying to navigate these waters and learn more. I feel like a novice. I feel like I've got so much to learn. It's not where I thought I would be this far in my career, especially without changing specialties. Like I haven't changed specialties. I've just recognized that I don't know crap.
Well, we're seeing the passion that you have for others, especially in this space. I mean, because you were in nursing, in a psychiatric setting, and you were forced to kind of leave that situation, but you haven't left or abandoned those people that need that help that you worked so many years with. Because you're continuing on with this coaching and trying to get a grassroots effort started in that effort and in order to help those people. So, that's definitely, I think this is your calling for sure.
Yeah, I'm definitely passionate about it. I'm doing lots of reading and talking with people. I'm reading Brain Energy right now by Chris Palmer, which is connecting a lot of things in really profound ways. And really, it makes sense with all my experiences within the mental health establishment and all my experiences within the carnivore community. Like it's really that book is tying things together really well and kind of laying out a roadmap for both the problem and the solution. So
Yeah, that's awesome.
yeah.
So I want to get your thoughts on, when you first heard someone speak about a carnivore diet or low carb keto diet and it effectively healing their mental health condition. What were you thinking when you heard something like that?
Some skepticism just because I couldn't wrap my mind around what the possible pathophysiology of that would be. But then hearing it over and over from so many people just made me a believer, even if I can't explain it. Yeah, so like you, I'm kind of skeptical and cynical of a lot of things I hear these days. And like I said earlier, it's like I almost trust anecdotal evidence more than I'll trust something I'll read in a journal at this point. So I've just heard so many times from people that's made an improvement on their mental health when they weren't even doing it for their mental health. So you remove that whole placebo effect that's the backbone of so many SSRIs and stuff like that. It's a thing. I don't know exactly why. but it is a thing. So
Absolutely. Yeah. I mean, that I started for another reason, the carnivore diet, and it seemed to eliminate any feelings of depression and anxiety with me. And I had no intention of, I didn't really know that it was that much of an issue with me, but I did notice a marked difference eating this way in that area. So, that's one anecdotal evidence. And, like you, once you see so many anecdotal examples of this helping somebody in this area or even other areas, at some point it's not anecdotal anymore. I mean, it's evident that
right.
this is actually helping.
Yeah, absolutely. Absolutely. I would, before I forget, I would like to throw out a disclaimer to anybody who might be listening who's currently on any sort of psychotropic med, and that would be that you absolutely should not stop cold turkey. If you want to decrease or reduce your meds, can be dangerous, so you should definitely do that under the close supervision of your provider, and also not to dump on them so much that people don't believe they can be effective. I personally do believe they are wildly overprescribed. I also have talked to a multitude of people over the years who would swear up and down that they saved their life, and that's valid and has been the experience for some people who take them. So nobody should stop their meds cold turkey just because of something I said. But if you're interested in decreasing doses, definitely do that under the supervision of your medical provider. If you get your metabolism in order before you start, that's going to make a huge difference. So just wanted to throw that disclaimer out there before I forgot.
Absolutely. Yeah, I love that. So that kind of ties into what you were talking about before, that essentially your metabolic health, your health is should be the basis for treatment in this area. Yeah, right? The foundation. So
Yeah.
lay the foundation properly, and then you can kind of work in other areas in terms of, maybe a person does need some sort of prescription or something like that, but you won't really know to what amount or effect that you're gonna need to have if you're metabolically unhealthy.
That's very well said, Adam. I 100% agree. Absolutely.
So, in terms of your coaching, when someone works with you in order to possibly improve their situation with their medication or their challenges or their struggle in life in terms of their mental health, is working with their provider something that you do?
So that's a work in progress too, because I'm still networking with people. So that hasn't happened yet. And I'm trying to figure out the groundwork for having that happen. One of the things that's complicated is doing coaching over Zoom and stuff like that is if people are coming to you from all over the country, you're not going to establish relationships with doctors all over the country, So if everybody who comes to me has a different provider, it's hard to establish that relationship and that trust and work with them. One of the issues with that is like I don't like we just talked about, I don't think the time to start tapering meds is even going to come along until somebody has, you know, gotten off the standard American diet and kind of stabilized on carnivore, keto, or whatever is right for them. They have to go through that process first before they can even start their tapering journey. So I I would like to work with providers. I guess the dream scenario would be to do it locally. And I do know a couple providers locally who are like-minded. So it's a work in progress. My business is young and fledgling, but it's a work in progress.
Yeah, that's awesome. It's great to hear that you have this passion for helping others and that you're at the ground floor and you have the potential of essentially changing this space, not only for yourself and those around you, but for other people in this area, because it doesn't seem like there's anyone that's really focused on doing exactly what you're doing right now.
Yeah, it's definitely an open market and something a lot of people would stand to benefit from it. A lot of people, I mean, tens of millions of people taking antidepressants in this country, and rates of mental illness just keep climbing higher and higher and higher, along with metabolic disease and autoimmune disease. So yeah, it's is important to spread the good word. And one of the great things about the carnivore community is people feel so amazing. They want to get out there and spread the good word. People like you with your channel, and like, you know, lift others up and have them experience the same benefits that they themselves have experienced. So that's awesome, Adam.
Absolutely. Yeah. A rising tide lifts all ships. So
Yeah.
if I can help in any possible way whatsoever, you just let me know and we'll do it for sure. So,
Awesome.
so where can people find you if they're looking for potential answers for themselves or some help or guidance or coaching in this area? Where can I find you?
So my website is describe.health or describehealth.com.
Okay, awesome. So, and what's the process for them? Just hit contact us and go from there.
Yep, I've got my emails up on there. I'm still working on some forms and stuff like that and getting the payment processor going. So it's a work in progress, but if somebody is interested, they'll be able to contact me down there. Yeah.
Okay, awesome. Well, David, it's been a pleasure talking with you and really learning more in this area. This is very interesting area for me. I have loved ones that are affected with mental issues and things like that. And to know that there is a resource out there or will be in the future spearheaded by yourself and potentially others that you inspire to do this sort of thing as well across the country is absolutely incredible. And I appreciate you and applaud you for that. And thank you for joining me today, David. I really appreciate you.
Thank you, Adam. It's been a pleasure.